health carriers. If you got any questions, I'll be more than happy to address them for you. So, anybody have any questions? We've talked over here pretty much what everything is. Everybody's going Blue Cross, right? Everybody's going Blue Cross $300, right?
Well, yeah, that's right. What other choice do you have?
Well, okay, you have many choices.
Yeah, but I mean, any good ones?
Well, first of all, you guys all should consider going to an independent agent for 2017. That's number one. Because you're not going to find the information any other way unless you do a lot of digging. And myself, I've done a lot of digging. I've talked to Medicare, I've talked to agents, and I'm going to go to an independent agent. So I would say right off the bat, one of the things you want to do is go to an independent agent. An independent agent that handles everybody or as many of the healthcare carriers as possible. Now, one of the things that seems to be jumping out of here, I can't talk over you guys. One of the programs that seems to be jumping out is Plan G. Plan G. Okay. Now, C, F, and G are almost identical. Everybody's in. Most of the guys are in Plan C, Legacy. Right? Most, or F.
This doesn't have anything to do with the union guys. They got the union.
Yeah, union guys is only salary. Salary retirees, Blue Cross. Well, salary retirees. Program C, as you know, covers every excess charges that a doctor could possibly charge over and above what Medicare charges. Okay. Plan F covers those charges. Okay. But Plan F has been always higher premium-wise than Plan C. Plan G is like Plan F. It covers excess charges and everything else. The only difference on Plan G versus F and C is that when you have Medicare Part A and B, Part B has a deductible of $166. Plan C and F cover that charge right off the bat. Plan G does not. So you have to pay that $166 up front for any medical bills that you may run with doctors, labs, not hospitals, but doctors. So right off the bat, you have a $13.18 per month additional charge to your healthcare premium that you have to factor in. As an example, if I stay with Blue Cross Blue Shield, Plan C, Legacy Plan, which is a strong possibility it may disappear in the next 2 years, I'm paying $293 on a monthly basis for Plan C. Okay? That's what I'm going to quote. A Plan G for 2017 with F, and I've checked this with a couple of agencies, $194. So you can see there's almost $100 difference. I'm not pushing in, don't get me wrong. What I'm saying is that everybody is now age-related versus community-related. What that means is that Blue Cross and Blue Shield currently and Priority Health were community-related. Everybody paid the same price. You now are in an age, everybody, all the insurance companies have gone to an age-related. Your premiums are based on your age. I'm going to be 79 by the end of the year, so my premium is going to be right around $195. Plus the deductible I got to pay. So I'm looking at around 208, 209. G seems to be jumping out only because it's very competitive, and F is going away by 2020. So if you join F from C to F, you're going to have to consider down the road within the next 3 years changing another health carrier. Every time you change health carriers, you've got to go through a medical underwriting, which means the new company wants to sit down with you and talk to you about your health situation. And those things for the last 2 to 3 years are what's going to affect your acceptance into a new program, new insurance carrier. Now, on a Medicare program, you can change carriers every month. But every time you change carrier, you're going to go through a medical underwriting. Even if you stay with Blue Cross for 2017, there's a good chance you're going to have to go through a medical underwriting. They may require that. She just crosses her legs.
What's this medical?
Oh, They sit down with you, they want to know in the last 2 to 3 years, and they will change from company to company, health carrier to health carrier. Do you have diabetes? It could be a rejection. Some companies could reject based on that. Do you have heart conditions that they may reject? Do you have cancer that they may reject? Do you have retina problems that they may reject?